taking the blood pressure of some of our audience members, which is something that happens often when you go to the dentist office nowadays. John Dingle says it may have saved his life. Welcome back, Dr. Terri Alani, to share how dentists are taking a bite out of heart disease as well. But before we actually get to that, we wanted to mention that February is Heart Month, but it's also...
It's National Children's Dental Health Month, and we encourage everyone to take their children in to see the dentist.
Yeah, it can be a fun experience.
Yes, exactly. Diagnose problems early, early on. But what I wanted to talk about today was the relationship between your dentist and getting your blood pressure checked.
Because people ask that question. We've had that before when you've been on, and people say, well, why does the dentist take my blood pressure? And some people will say, well, it's because you're at the dentist that your blood pressure went up, but that's not the case.
Do you know that 1 in 3 people have high blood pressure, and it's called the silent killer? It goes undiagnosed. The dentist, the dental office, and the hygiene appointment are now the #1 weapon against identifying people that actually are high risk for cardiovascular disease.
And that's the cool thing about this, is that people who might not have ever thought to go to perhaps a cardiologist or anything, obviously, would come into the dentist. So it's kind of like we have different gatekeepers, if you will, who can try to catch something like this. And the situation for you was what? You're going to the dentist and...
Yeah, I was basically being a good boy. I was doing my 6-month checkup with Terri, and I've been going to Terri for a lot of years, and this last visit, my blood pressure was very high.
Yeah.
And so, Terri said, you need to get this looked at. And so I did. When I left her office, I called the cardiologist she recommended, and went in, and I called that day and then made an appointment for the following week, and found out a lot of things that I was doing wrong. Certainly diet was one.
Right.
And they, of course, found blockages that I wasn't expecting, like in my carotid artery, and I was shocked because...
you felt fine?
Well, I felt fine, and whenever I've had a physical, like my cholesterol is low. It's like almost off the chart.
Right.
So I told the cardiologist, I said, this can't be. I said, how can this be? And so he said, well, there's other factors that are involved. And so he's put me on certainly a special diet, similar to what was discussed earlier. And I can tell it's already made an impact.
Yeah, because you were heading toward, according to the cardiologist, heading toward that heart attack.
And one of the things that triggered me, well, we check blood pressure routinely, but with John, he'd been coming in to see me routinely, but his gums were bleeding a lot more than usual. And I asked him, I said, John, how's your blood pressure? It's kind of high, but I said, well, how is your blood pressure? So we checked it, and it's not really, yes, your blood pressure is going to spike a little bit when you go to the dental office, but regular blood pressure, normal blood pressure is 120/80. The cardiologists have now stated that anything over 120/80 needs to be checked by your cardiologist.
Right. And there is a direct link between poor oral hygiene and heart disease.
Absolutely. Actually, periodontal disease is a risk factor for heart disease, and periodontal disease is now as common as the common cold. And you've got your signs and symptoms are bleeding gums, bad breath, if you have a lot of tartar on your teeth, if you've got just pus coming out in between your teeth. But that is our role as dentists, is to help prevent these things from occurring. And also, the oral health, or your state of your oral health, is a predictor of your overall body health. And people are not aware of that. We diagnose diseases that are life-threatening, such as diabetes and heart disease, in the dental office.
And bacteria can trigger blood clots?
Bacteria can trigger blood clots into the bloodstream that can actually trigger a heart attack from gum disease. And also diabetes. We diagnose diabetes because if you come in, people that have diabetes and uncontrolled diabetes are more susceptible to periodontal disease. In fact, periodontal disease is considered the 6th complication of diabetes as we see it. And if a patient has uncontrolled diabetes, or if they have periodontal disease, it's harder to control their blood sugar with diabetes.
Which is why it's really important when you come in to a dentist office, or any doctor's office at all, but in this case the dentist office, to tell them right away, here's what I already know I'm dealing with.
Exactly. Open up dialogue with your dentist, tell them the medications you're on, tell them any type of health history, because we don't just treat the mouth anymore.
Right.
We treat the overall health of the patient, and that's what's important.
The other thing I want to back up to, because people oftentimes say, well, yeah, but you're running around, you're trying to get there on time, you rush in, you lay down, of course your blood pressure is going to be up. But there's a difference between it just being up, and then when you have people who come in, like John did, regularly, you can also compare.
Exactly, you can compare. And the interesting part is these patients get upset at us. They get frustrated and go, oh no, it's not high. And I cannot tell you how many patients I have really, really reprimanded to go to the cardiologist, get checked, they call us back and thank us.
Yeah, like in this case right here, because otherwise you would not have been thinking about going there.
Well, that was me, because it wasn't this last time. At the time previous, Terry noticed that it was going up, and she recommended that I get it looked at, and I didn't.
Right.
And so when she took it this last time, and it was certainly higher, you know, my mouth was open. I was sitting in the chair, and she kind of whipped around at me. She said, "You did not follow up on that, did you?" And I said, "No."
Yeah.
So, but I did this time, because I could tell, the bleeding gums and everything, because that's not normal, because I'm good about flossing and things like that. So I knew something was wrong, and that gave me the incentive to get some.
Terry, you've had
get it
people or that you've actually sent from the chair to the doctor.
Oh, absolutely. Well, see, if a patient has a blood pressure of 180 over 110,
crazy.
that is the limit. We cannot treat that patient. Now, you can do emergency procedures up to that, but basically what I tell patients is, if they don't believe that they have high blood pressure in my office, I tell them to create a little diary. Go and have your blood pressure checked, or go to Walgreens or wherever, have it checked twice a day. Just check it yourself twice a day at different times over a period of 5 days, and then come back and bring it to our office, or go to your cardiologist with it. That will tell you whether your blood pressure is actually high or not.
All right. Well, we're checking the audience members over there, and just raise your hand, wave your hand to me if you've checked anybody so far that you think is really, really high. Have you seen some high blood pressure yet? Can you hear me? Raise your hand for me if you've seen somebody with really high blood pressure. Oh, she's counseling them right now. Okay, so she's busy. All right, well, you can find out more about Dr. Alani and the other dental services she offers at texastoothlady.com, or call her office at 713-621-5141, 713-621-5141. She and her brother, orthopedic surgeon Dr. Wayne Alani, also co-host the live radio talk show For Your Health with Terry and Wayne every Tuesday at 1 p.m. on AM 650. They talk about health and everything else.